I am your host, Dr. Joel Brown, and I am joined by Dr. Neil Naik. My guest grew up in the Greater Toronto area, trained in medicine at the Royal College of Surgeons in Ireland, and completed residency in urban Newfoundland and rural Nunavut. That range gave him an early look at how technology reaches communities and where it falls short. He now practices family medicine in Waterloo, Ontario. His clinical work includes weight management consulting and AI-based skin cancer screening. He serves as clinical lead for Patients Before Paperwork at Ontario Health, chairs the clinical council at the Centre for Bioengineering and Biotechnology, and teaches at both McMaster and the University of Waterloo. Along the way, he added an executive MBA from Ivy and certification from the American Board of AI in Medicine. I'm going to talk to him about leadership and what it comes down to as well. And so without further ado, let's welcome Dr. Neil Naik. Hey, Neil.
Hey, Joel. Thanks so much for having me today. I really appreciate the opportunity.
You're welcome. And, I want to start by acknowledging, Neil, your friendship and support as someone who's still relatively new to Ontario, finding my feet, getting my bearings as to how medicine works here, how innovation works here. And your friendship, your willingness to invite me in, to have conversations, to connect me with other like-minded physicians has really made a difference for how supported I've felt. And I know others have felt this way. You're truly selfless as it relates to your network and how much you give access to others, especially those who feel like outsiders. And so I just want to acknowledge that not everyone does that. And your willingness to do that has certainly encouraged me as I've been finding my place. Absolutely.
It discourages me that others don't do this. But for me, having traveled around so much, having had to recreate networks over and over again, I see that difference in terms of what does it mean to have somebody who can help to guide, understand, teach, but also at the same time, what it feels like when you don't have that and you gotta figure it out for yourself. It's possible in both cases, a lot easier when you have somebody who's willing to share.
Totally. And, you touched on the notion of growing up or moving around and living in different parts and how that forces you to recreate networks. I had a similar guest. I had a podcast episode with a guest who, mentioned similar things. And just going back into your story that I mentioned in the intro, growing up in Greater Toronto and then, having to go to medicine all the way in Ireland, not too far from where I came from before I moved to Ontario, and then going to, residency in Newfoundland and rural Nunavut. I mean, part of what I've found so fascinating about Canada and the ecosystem here is just the expansiveness of this country and just how different parts of Canada can be. And you can't just assume one model of healthcare or just one approach to innovation is just naturally going to work in different places. And you've got to be willing to find people in new places and network and ask those hard questions and put yourself out there. You can't just assume you go to a new place and everybody's going to know who you are. And the internet makes it easier because you've got LinkedIn and these other things that you can kind of reach out. But I wanted to just kind of hear from you, just give us a little bit more of a glimpse of that origin story. Growing up in Toronto, what that was kind of like for you. Just maybe what are some of those formative stories that define the person you were at the start?
Yeah. I was just going over photo albums with my wife, my mom, the other day, and there's a picture of me in my dad's lap as a baby. Mm-hmm. And he has a Windows 3.11 computer on the ground with me in his lap, and he's trying to learn how to use it. And I'm there as a kid, not knowing anything about computers, seeing him do this. And I think that really drives into me where I learn a lot of my personality. And the older I get, the more I realize how much of an influence my parents have had on me. My dad was a very creative individual who he found out what his niche is. Mm-hmm. And then went into it, but it didn't stop him. He didn't have blinders on. He actually worked 3 jobs. Mm-hmm. And I remember growing up every year, there would be 7 times of the year where he'd be working from 6 a.m. to 3 a.m. Mm-hmm. Just going from job to job. And I think that really reflected into me in terms of what work ethic means. and what it means to not just define yourself based off whatever degree you have or whatever you decided your career was, because it's going to change. It's always going to change. And I think the definition of what we are is adaptable. And that's what my mom has instilled in me as well, which is, what is adaptability and what does it mean to say, really, you can't do that? And she'd always question that, be like, what do you mean you can't do that? So like there was this mall in Scarborough where I grew up, and Zellers was a store. I think it's coming back now, but Zellers used to have a fashion show in the middle of the hall, in the mall. And, a shy kid, I think I was like 6 or 7 or something like that. Mom was like, you're doing this. And she signed me up on the spot. Next thing you know, I'm doing a fashion show for Zellers in the middle of the mall. It was great. Now looking back at it, I'm like, that was probably one of the scariest things I did. Probably one of the more defining things I did. So it wasn't that I was jumping around from house to house or neighborhood to neighborhood, but I was, we were in Scarborough, which is a phenomenal place in terms of the multiculturalism and learning about different people, different ethnicities.
Yeah.
But having an older sister, she would also help to guide my education as well. And so she'd tell my mom, be like, hey, you know what, you gotta send Neil to French Extended. You gotta send Neil to the IB school. And so, typically you go from your elementary school to your middle school that's assigned for your neighborhood, then your high school. But my mom, my sister, my dad worked on getting me into the specialty programs, which meant that I had to relearn my entire network each time, and I was not good at it at all. Making friends was one of the hardest things in my life, and even now I'd even argue I'm not that great at it. Like, it takes a lot of effort and time and thinking for me to learn how to do that. And so that was part of me relearning my entire network over and over again. And I don't think I really got into a rhythm, honestly, until I hit Nunavut. That's where I got forced to. Iqaluit is it's the main capital there, so I'd still consider it rural primarily because of the location, the population size, all that other stuff. But I learned how to build a network in a place where your internet might go down, where you meet some new friends while you're out doing a week of care in a small hamlet, where they're like, I'll meet you at Wing Night Wednesday. Instead of exchanging phone calls, and lo and behold, you go to Wing Night Wednesday and you see them there. And I thought that was one of the best and coolest things to experience as an adult when smartphones were like becoming the mainstay, where people are still buried in their phones. And when I go out to restaurants even today, I'll see whole tables where they're all on their phone, not talking to one another.
Wow. Now, you know what? I'm just reminded again as I'm listening to you how important it is to be invested in understanding people's origin stories, because there's so much of what you've shared I can genuinely say I'm hearing for the first time, despite being connected with you and having and it's great. Sometimes you don't want to force these conversations when they're ready to happen. But I'm marveling at so many of the things you said. Thank you for starting with your parents and just kind of naming them and the legacy, the contribution they made to forge, that initial identity, that sense of who you are, what is possible for you. Love that, what you said about your mom just saying, hey, don't let anybody, or, this notion of like, there's nothing that you can't do. And even sharing that little experience of doing that fashion show thing at, the mall in Scarborough. That's like great, because one of the things I'm super passionate about is that like physicians and medics, we don't have to be this like one narrow identity where we can't embrace like lots of different things, lots of different passions creatively, beyond that. And so thank you for just naming that. And then really kind of helping us understand that you've had challenges when it comes to networking. These things don't always come just immediately like this innate thing that people can do. But yet at the same time, like I started out with the podcast, I'm saying your innate your ability to make people feel welcome, to create inner smaller communities of conversation, especially for someone like myself being an outsider. I look at that and go, gosh, that like is one of your biggest skills in terms of what I can see about you, and just acknowledging that you're saying, hey man, it wasn't always that way.
Yeah.
And going to, no, like none of it. So you must understand the average person around the world thinks of Canada from a very Toronto-centric, very Ontario, they'll have heard of Vancouver and possibly Alberta because of like Banff, Lake Louise, that sort of thing. They probably have never heard of Nunavut. Do you mind just sharing a little more just of what you know, just so that we get a better understanding of how far, say, Nunavut is from Toronto, how different the kind of ecosystem or culturally it is there compared to like the baseline of Toronto?
Yeah, absolutely. And just so you're aware, like I haven't been to Nunavut since 2015, so a lot may have changed since then. Yeah. So I'm going back to what I experienced back in 2015, 2016. But if your listeners can imagine Canada, like you see the East Coast with the islands and peninsulas, and you got Quebec, and then Ontario kind of swoops downwards, and above Ontario there's this Hudson's Bay. Goes straight north through Hudson's Bay, and there's an island that you hit called Baffin Island. That's where Iqaluit is, or about 3 hours straight due north from Ottawa, or even 5 hours straight due north of Toronto. It's a magical place. I still recommend to anyone, if you can get there for even a small hiatus, please do. Like, it has changed me personally and professionally in the way I work. Your summers are 25, 27 degrees. June still has a ton of mosquitoes, just like anywhere else in Canada, but 25, 27 degrees. And then the winters hit minus 40, minus 50 degrees. And when you hit the wind chill, even worse than that. By the way, past minus 30, it all feels the same. So it doesn't matter, but I think it was the first time I've ever worn 5 layers and never complained. I remember as a kid, like, again, just glimpses of memories of my mom trying to get me to wear like 3 layers to handle the minus 15 here in Toronto, and complaining about that. No, 5 layers was not even enough when I was up there, but it was such an incredible time. So there's a hospital, and it's run back when I was there all by family doctors. You'll get the anesthesiologist, you'll get the emergency room doc who wants to do a couple of months or years of contract work up there, but very much family medicine run. We ran clinics in the hospital. We did the inpatient emerge. Obviously not radiology. The images were sent down to Ottawa for them to be read. And then every week we'd have a different group of specialists and the residents come up north and stay for a week with us. Which was cool, because essentially every week I got to learn how to make a new friend. Which was such a great experience for a person who, I'm an introvert, but for a person who's an introvert who historically had issues making friends with people, this was incredible for me to learn about this. And just build my network from there. What else can I tell about this place? Like, because it's such a rural place, got into my love for hiking, got into my love for exploration. There's a hike to Apex from Iqaluit. It's about a 45-minute to an hour hike, and one of my preceptors took me out. An emerge doc from Cape Breton, and he had a book about Arctic vegetation, and we spent 4 hours on that trail eating Arctic lettuce, trying berries, all these different things. And there's no trees up there. So there's something called the tree line. And I feel like this is something that a lot of Northern Europeans, Russians, and Canadians get, but nobody else knows about. So there's something called a tree line, where no trees will grow past this line when you go north, just there's not enough sunlight. So there's no trees. You could look out and there's nothing. So I used to go hiking in the middle of the tundra in the wintertime to go look for northern lights. And so just overall, just a very magical place.
It's fascinating, and thank you for sharing that insight, because for me, I'm learning, even as someone who's still relatively new to Canada, and kind of understanding the vast differences of what it's like living in different places. But one of the things you mentioned, which I think is important to acknowledge, is how, that the experience of living in these different parts of the world help to contribute to your understanding of even how, healthcare and technology, how these things play out, and the kind of problems that patients and practitioners face. I want to pivot a little bit, if that's okay, to going back to what led you to Ireland to study medicine, because obviously you grew up in Toronto. Just talk a little bit about why you would have gone there instead of a medical school either in Canada or the US.
Yeah, absolutely. So I always want to be an astronaut. I still look for the applications, and I will apply despite my wife not approving. So always wanted to be an astronaut, still want to be an astronaut. But back when, grade 9, grade 10, you have to decide on what career path are you going to take? What are your electives you're going to take in high school? Where are you going to go to university? Because grade 11, you're applying. I grew past 6 feet and I had glasses. And back then, they did not know what the impact of G-forces would be on the eyes that have undergone LASIK eye surgery. And I grew past 6 feet. And back then, the maximum height you could be was 5'11" because you couldn't fit into the spacesuits. I think they've changed it now. It's like 6'3" or 6'4" as your maximum height. And so I had to decide, being like, this is not a viable career anymore. What do I do? And so my sister had just gone into med school in Ireland, and she was having a grand time just learning, one, about medicine, but two, honestly, just being away from the parents. That was another appeal, which was having helicopter parents. How do I start finding out who I am and building what that person is? I love to travel. Growing up, we went to India twice, I think, and the rest of the time I was going down to the States to visit family. But I still love to travel. I love to explore, try new foods, all that other stuff. And so Ireland just had that appeal. My parents did not think I was going to be a doctor. They thought my demeanor, my personality, all those things I talked about earlier, which I struggled with. They're like, really? You, doctor? But for me, what drove me was, what do I want to do for the rest of my life? And I did not want a desk job. I wanted something that had an obvious career path. You go to med school, you become a physician. I wanted that. And so while I talk about pivoting and knowing adaptability, part of it is also that safety. I knew I wanted to have that pathway there. And if I couldn't be an astronaut, engineering wasn't really appealing to me. I'm going to go down this and to get into one of the pathways to becoming an astronaut is to go through aerospace engineering. Well, then how else could I be an astronaut? And the other way was being a physician. So I went down that path. And then I was like, well, I'm in high school. My sister got into med school. Why am I wasting 4 years in an undergrad to go take an MCAT exam for the chance of getting to medical school? Let me just try and get to medical school now and see what happens. So I got in. My parents helped to support the education. I don't think I'd be able to do it without that and my parents' work ethic and all that. And went to med school, and every year whenever we had to pay tuition, my mom's first question was, good job passing. You sure you can do next year? Are you sure you're going to be a doctor? All that other stuff, which I still laugh about with her every single day now. And lo and behold, I'm here. And yeah, so that was the reason why I went to med school, was 1, to get far away and learn who I am. 2, to travel and experience new culture. But 3, med school for me was my way of saying, okay, cool, I can be a physician, but how many branches can I go out from? For a good solid 5 years of my med school career, I call it a career because med school is challenging at its easiest of times. I wanted to be a neurosurgeon until I realized, that's not the life for me. And so my early research is all in neurosurgery, but then I switched over to family medicine because I realized I still want to go back for being an astronaut. So wilderness medicine is going to be my retirement plan, and family medicine is my route to wilderness medicine.
Wow. I don't think I've ever met someone who pursued medicine as like a segue or a pathway to become an astronaut. I love this. This is the reward of conversation of like, just stop with assuming everybody's reasons are the same for doing things like that. There's so much lost when we do that. I mean, this is fascinating, Neil. Thank you. So going to Ireland then, I mean, you got a chance to go to Europe, and of course med school there, I imagine would have been five years. So that's a good
6 years.
6 years, yeah. So a good amount of time immersed in a different place from the origins of Toronto. I just wondered if there was anything you took away from that culturally that informed anything about the goals that you later cultivated or developed. Anything interesting?
Yeah, so what I loved about Ireland in the school I went to, RCSI, was how multicultural that was as well. There's a sister school in Penang, Malaysia. There's one in Bahrain as well. And the first couple of years, you're all grouped together with them. And again, it's reforming those networks. And it goes back to the same theme, and it becomes the theme of my leadership career as well, which is everyone has a mission, vision, and values. Anyone can create that. Anyone can be a lone wolf or a solo wolf, and that's what I was raised to be, which is go do it yourself because you know how to do it well. And what I learned over my career of schooling, being a physician, a leader, is you have to bring the people with you. And if you don't, it's not going to work because a lone wolf doesn't make an impact. Only a pack does.
That's good.
And so how do we bring everyone with us? How do you not treat somebody as the weakest link? They're not the weakest link. They're actually the people who ground you to say, or what you're doing, is that the real thing? And that's what Ireland taught me, which was, okay, let's go find out who my pack is. Let's find out who I am while I'm at it, right? This would have been pre-Nunavut. So I'm still finding out who I am, still trying to figure out what my scene is, trying to figure out what is that personality I get along with. Because I was in high school, I had parents, you're studying, I want to get into med school, I figured this out in grade 10, grade 11, I'm going for this. And so now I'm in med school. How do I take that to the next step? So while I was in Ireland, it was, let's go to Taekwondo. So went to Taekwondo, eventually became captain of my team.
Mm-hmm. And
captain didn't necessarily mean that you were a black belt or anything like that. It actually just meant responsibility, building a team, coordinating practices and booking things out. But it also meant what leadership meant at an early stage. And God, I made so many mistakes. But I learned from that. And I had great coaches that taught me along the way because they've been our coach for, a good solid 6-7 years before I even showed up.
Mm-hmm.
And then made friends that otherwise I wouldn't. I have a whole bunch of Irish friends that if I had stuck to my, I think my school was like 80% non-Irish. If I stuck to the crowd that I was comfortable with, I would never have learned so much about the culture there in terms of why, you can go to all the museums you want, but lived experience is one thing. Getting to hang out with friends who are Irish and finding out what their lives are, just like you said, instead of making those assumptions, can I learn more about them? Just change that whole piece. So it's following people. And I can take that over to my experience in Nunavut as well. Like, I remember doing a house call in Nunavut when I was at, in a small hamlet where we did week-long stints. And, we went and saw an elder in their house and they were telling us a story. And one thing I remember learning back, early in my career was people are like, you have to see X number of people per day. You need to be efficient. You have to put food on the table. And I see the practicalities of that, but I don't see the value of that. And I learned back in Nunavut and reinforced it, which is actually the people are what matter. And if you can make a connection with your patients, you can do so much better. You can do so much more for them. You can give better care just by understanding who they are. And so with this elder, she was telling us a story about how, back when tuberculosis was going, or still going around, but it was really, really prominent. We didn't have an effective treatment. They used to send Inuit to Ottawa, but because they couldn't pronounce their names, they would tattoo numbers onto them. And I was just like, what is this? This is, Holocaust level of what Canadians have done. And then she showed me the tattoo of a number. I was like, wow. Like, I never learned that a single day in school. I never learned about any of this. And it's just knowing what the trauma people go through, but also the way they've learned from it and all that stuff. It's the people that matter and how we can treat them matters from there.
Jeez, man, that stopped me in my tracks. I have to admit, again, I think when you said that the drive for efficiency and numbers and trying to hit whatever quota that we've been told will help to achieve, certain goals, while the pragmatism of that feels so important to prioritize. But if doing so, you overlook the stories, the important narrative that helps to truly understand who is sitting in front of you at every encounter, to understand their why, the pain, the trauma, whatever it is, that's a failure, because you can't reach people effectively if you're not willing to just be silent and listen and witness the truth of who they are. And you can't really help anyone in any kind of meaningful, sustainable way unless you prove yourself to be trustworthy of their story, trustworthy of their experience. And just hearing you share that story has really moved me. And as someone who's still coming to grips with this nation's troubled history, I think Canada has impressed me with their efforts to try to reach Indigenous people and have better conversations about land acknowledgement and so on. But like you said, there's still a lot of hidden history and trauma that might not be in the cultural awareness of many people in this country, certainly newcomers. And so there's a lot that I want to learn and I want to hear these stories so I can better understand these communities that are often on the margins and aren't seen as, their stories aren't seen as sort of valuable or important. And we've got to be so mindful of that. So thank you so much for just speaking so openly about that, Neil. I want to talk a little bit about some of what you're doing now. So family medicine, I'm a family physician as well. Yeah. And you mentioned you perhaps in medical school, neurosurgery initially had this appeal, but the lifestyle, how much that would prevent you from pretty much doing anything else. You saw family medicine, a better specialty for you. What are some of the things you've found in family practice that, how would I describe it, that you've just found helpful, useful, how it informs the way you think about problems? Because we know that as family physicians, we are trained to be generalists, so we know lots of things. We have areas of domains of knowledge where we have to know there's this broad spread. We're not necessarily required to know the insane levels of depth within each of these specialties. But just, talk me through what you've found to be most rewarding and helpful and useful about being a family physician.
For sure, yeah. And I want to preface this by saying, this is not meant as an insult to any other specialty or specialist, nor is it meant as a criticism. It's just more so just what I love about family medicine and why I went into this. For me, it was the pivotability or the adaptability of the profession, but at the same time, it's also the sleuthing. You could be a family physician who's a referologist, where, you identify the problem, you see what domain it lands on, you do some first primary initial things, and if you can't solve it for the 80 or 90% of those cases, you refer to the most appropriate clinician. And I think that's a great way in terms of making sure that we are stewards of the system. Some people will do some interventions a little bit more than others. Some may not order as many tests as others. And I think that's where you get the spectrum or the broadness of family medicine. And I love my experience in Newfoundland and Nunavut, where we don't have every single specialty, at least we didn't when I was training there, meant that I had to figure out what test do we do? Is the pursuit of knowledge an academic one or a practical one? How do we balance whether or not, when a patient's asking, well, should I fly somewhere to get this treated or should I stay here in town? That's what's fascinating to me about family medicine and ultimately why I chose it. Which is, it's seeing people, one, as we talked about, in that privileged space where people will tell us their deepest, darkest, happiest, saddest thoughts that they won't share with anyone else. They won't even share with their life partner sometimes. But I'm there to support them, or we're there to support them. But at the same time, it allows us to be any flexibility of what care is. And don't get me wrong, I am not great at everything. I am not the best person from a sports medicine point of view. My wife's a family physician as well. She is miles better than me at sports medicine than I am, and she's not even a sports medicine doctor. Whereas for me, I love weight management, diabetes. I'm good at liver care and try and stay up to date with that. And so I think we all find our little forte, but it also means that I don't have to keep blinders on for the rest of my life. And that's what I loved with it at the end, because I was thinking near in med school, being like, can I do this day in and day out, year over year? And that's what got me to say no to neurosurgery, then no to general surgery. And then I was thinking about internal medicine. I was like, all right, do I want to do internal medicine? And by the way, I applied to all 4 specialties for residency. Family medicine I chose at the end, but internal medicine. And then I realized, okay, internal medicine versus family medicine. What do I do? Because internal medicine also has that variety and all that other good stuff. And it's going to sound silly. I chose not to do internal medicine because I wanted to have the first go at searching and trying to figure out a patient's condition before I had to refer them off. But number 2 was I didn't want to have to trade call shifts, let alone do call. I wanted to sleep at night. And so for that reason, I chose family medicine because I want that ability, that autonomy to go into my office. And obviously I don't do this to my staff all the time, but should something happen, and unfortunately that did happen back in 2021, 2022 in my life, where I had to go in and get my staff to call my patients for a whole week and reschedule them. And I gave them permission to share with my patients why I had to as an emergency. But that would have been so impossible to do, at least I think it would be in the back of my head, had I had to ask another colleague to take over my call, to take over my shift when my family needed me.
Yeah. I love that. Man, that's, you answered that question beautifully, and you really helped to, I think, give a profound understanding of some of the unique opportunities within family medicine. Part of the reason I think it's important that family physicians do this is because when I did medical school, family medicine was kind of seen in a more negative light compared to other specialties. That's the honest truth. So even when you gave when you mentioned before you started talking about your reasons, you were cautious to not try to say you were pedestalizing family medicine as better than other specialties. Well, in my world, it was the other way around. It was like specialties were given the automatic assumption of this is the path of medicine that is more celebrated, respected, seen as more of an achievement, while family physicians were kind of those who didn't get into specialties training or didn't really want to commit or just were afraid of the hospital or whatever it was. Like there were lots of negative stereotypes. And because I think that every specialty in medicine truly matters and is necessary, we should have a view that celebrates what's unique, or the contribution of every specialty. And one of the things I've tried to lead and to talk about is to say there is something unique about what family medicine can offer, and it shouldn't be seen as, oh, this is just either the path that people who aren't smart enough to do radiology or, aren't hardworking enough to do OBGYN or whatever, but actually there are unique challenges, there are unique opportunities. There's certainly aspects of family medicine that might not be appealing to some. And so for that reason, those people probably are better off not doing family medicine, and that's okay. But I believe, and I strongly advocate that it gives physicians an opportunity to genuinely create a very unique relational basis with the whole person-centered care, where it's not necessarily purely just about whatever symptoms they may or may not have, where there is this ongoing, continuous, integrated relationship. And like you said, truly opportunity for problem solving and trying to figure out, well, what are the core issues, concerns, worries that this person sitting in front of me has, and how do I help them as it relates to those problems. But it's not just this kind of problem-solving thing. It's this relationship building and continuing to have that in the context of their family, whether that's their significant other, their partner, their children, their parents, or close friends. And when I think about Canada and some of the challenges, what brought people like me here was this, what is considered to be a lack of doctors, medical students choosing family medicine. They're choosing other specialties, and there are lots of reasons for that. I'm aware that it's I don't want to be at all guilty of reducing that to one thing, but because of this deficit as it relates to not enough doctors choosing family medicine, it's created a narrative. There's some concern, like, is family medicine still worth it? Whether those are financial concerns, if people are worried about fair compensation compared to other specialties, or stress related to admin. And I can touch a little bit on the patients before paperwork stuff that you're involved in, because there is a real question or concern about burnout and family doctors feeling disgruntled and feeling like they're just not able to deliver and do the care that they would prefer to do because of admin. So these conversations are, I think, important to help us to understand the challenges, to speak honestly and openly about the opportunity in real terms, in an honest way.
Agreed, 100%. One thing I get all of my medical students to do that rotate with me, and even residents, is who aren't sure if they should do hospitalist, family medicine, an added competency within family medicine, whether it's anesthesia, palliative care, et cetera, is there's a video, a TED Talk by a gentleman named Simon Sinek, and it's called Start With Why. And I watched this, I think, I don't even know when it came out, but I want to say 9 years ago, and I really wish I saw this, way before, because it would have helped all my interviews. But part of that is, in something, again, my mom has taught me, is everything will get you money. Different things will get you different amounts of money. But to say that your why is money makes no sense, because that's the why for everybody. It doesn't define you. It doesn't tell you how you're different from everyone else, because all of us are unique. And if we're all unique, then how can you describe it? And if you don't even know how to describe it yourself, how can you expect somebody else who's trying to hire you, whether that's residency, a job, anything at all, be able to say, okay, you know what? I want Joel on my team versus I want John on my team. And so starting with why, what drives you is by far the most important thing. And then from there, determine, okay, what career change will allow me to achieve that why.
That's good.
Yeah. And you know what, lo and behold, that's probably what I went through, not realizing it back in, you know, when I was trying to decide which residency program to go to. So I got interviews in all 4 of those domains: gen surg, neurosurg, internal, family. And I was like, okay, I got to do my rank list. And it's slightly different from how they do it in Ireland. I'm not sure if it's similar in the UK, but you go through your intern training, I think it's foundational years in the UK. Then you go to your internship, junior house officer, senior house officer, et cetera, SPR training. And then you get to apply as you're going. Here in Canada, you go into a residency program and you need to know at the end of, like, in your last year of med school, how am I going to rank all these places where I did an interview? And then the computer program says, okay, cool, this is how we're going to match you. And it's a whole controversy. People love it. People hate it. So it's its own hour-long podcast. But that's when I was sitting there being like, what do I want? And realized at the end of the day, I like variety. I like going from room to room and helping somebody with a positive thing, a negative thing, and that adaptability. But ultimately, I want to come home to family and be able to cook a meal, to hang out with my wife on a couch and watch some TV. And not all specialties gave that to me. And I was like, you know what? That's what's important to me. It's not the same for everyone. Like you said, Joel, everyone has it different and you can change. I've learned that now that I have made my network of, like, you can be a specialist and be a community specialist. You don't need to be a hospital person. But I didn't know that back then, because when we did our rotations, they were almost always in a hospital. And so it was just starting with why, getting those rotations in, finding out what's out there, and figuring out, okay, what matches with what I want. And also I learned you can go back to residency too. I have a few friends who are going back to residency.
Yeah. Like, pivoting and changing your mind. I think we need to see that not as, you know, that you're flimsy or unable to commit, but that you're able to reevaluate. Like, if you're generally at a place in your life where what you're doing currently does not serve your why, like you put it, it takes a courage to say, hey, you know, I'm not so anchored to what I'm doing currently that, you know, that sense of who I am or my identity is so tethered to that I can't say, hey, you know what, there's something else that's better for me to do. In this last part of the conversation, I'm just so grateful for the depth that I've been able to draw out, but I've realized that we've kind of not touched on Waterloo. Like, why Waterloo? Why are you there now? What are you doing? Like, I know you're the chair of the clinical council at the Center for Bioengineering and Biotechnology. Just to touch a little bit on that.
For sure, yeah. So coming out of residency, I had a couple of different options of where I wanted to end up. So I was thinking about staying in Iqaluit, thought about St. John's. My mom's in Scarborough. And then, you know, there's Waterloo as well. My sister actually started up her practice in Waterloo. I did interviews. It was crazy. People still think I was nuts for doing this, but I did my interviews a week before my board exams because I just needed to get away from the books, and did them all the way from Waterloo, actually, all the way up to Kingston at various clinics along the way. And Waterloo for me was, one, family. So my sister was practicing here along with her husband. But two, it was technology. Going back to that picture of me in my dad's lap while he's on the computer, technology has been a huge part of my life. And, you know, computers should be there to give us a better human connection, not to take us away from the human connection. So being able to set up in Waterloo, seeing what technology can do, and, you know, none of the EMRs are ever developed by a public organization, and none of our drugs are ever developed by a public organization. They're all private industry. So I actually started consulting for a lot of the startup companies in Waterloo, and Waterloo has, you know, it has a really, really strong startup culture. Almost, I think they compare it to Silicon Valley of the North, essentially. And so I think within the first 6 months of coming to Waterloo, I became connected with an organization here. It used to be called the eHealth Center for Excellence. Now they're called Amplify Care. I started volunteering for them back then. I'm now an advisor for them. But I also got some business cards and started going out to hackathons and meeting with startup companies and trying to figure out, okay, physicians back then were not available to these startup companies. I was like, you know what? I'm happy to spend my spare time to help guide it, because a lot of the technology was designed for either insurance companies, the government, or patients, but not a lot of technologies were specifically designed for clinicians. And so how do we do that? And if a clinician doesn't use it, what's the point? So it took that route, and then along the way, just built my network. And University of Waterloo, with a doctor named Dr. Doug Dittmer, they were working on different innovative projects. Dr. Doug Dittmer is a physiatrist out of what is now Waterloo Regional Health Network. Back then would have been Grand River Hospital, and he would do a lot of rehab work. So trying to figure out how to do different prostheses. He'd work with the engineering school. And so through Waterloo MedTech and a bunch of different organizations, got to know that team, and eventually I got to the School of Optometry where I teach now, and that led me to the clinical council for the Center for Bioengineering and Biotechnology, which sadly actually has been shut down. But we're trying to figure out or at least I'm trying to figure out how to bring it back, because I think it was a great way to bring together all the different departments in University of Waterloo with a clinical council that you could test your ideas, whether it's mechatronics, whether it's prostheses, whether it's bioengineering, biotechnology, computer science, all of it. We could bring that together, and it was a really beautiful thing. But that's how I got involved in Waterloo with technology. And just to preface this, I may have laid in my dad's lap while he worked on a computer, but I was a chicken pecker at the keyboard until, again, my sister got my mom to send me to typing school and learn how to build and destroy computers when I was like 11, 12, 13, something like that. But I was a chicken pecker. And now I can actually type with all 10 fingers without looking at the keyboard, but that's not how it always was.
I love it. Chicken pecker as a term to describe those who use like one finger to type. I've not heard that one. And it's actually a relatable analogy. What's been kind of dope for me hearing you talk about Waterloo, my sister-in-law actually studied at Waterloo, and she's an engineer, and I've only heard through her story about this rich history of innovation, and it's particularly in the kind of engineering space at Waterloo. And where I currently live in Ontario, I pretty much drive through the Waterloo Kitchener area every time I'm going to Toronto. So I always kind of see it in passing. I've stopped at the big Walmart in Kitchener several times just en route. But, I've been really wanting to be able to hang out with you in Waterloo and just kind of come and just breathe in that air of innovation in that space. Cause I feel like it's a really special place in Ontario, and you get us of this hum and this hub of, like, how can we come together and, using, as you said, drawing bioengineers and biotechnologists and medics and like to solve like some of the issues and challenges. And just there's that, I'm attracted to that kind of, that electricity is a way I would describe it. So, I'm loving that you're there and championing that, and it's been so helpful for you to just share the way that you ended up there. Like, there's not like, okay, I was born in Waterloo and I'm here. It's kind of like, Toronto and then Ireland and then Nunavut and, Newfoundland and then you're here. And also, like you said, family being there also mattered for you to help that grounding. So I feel like anyone listening to this can get a sense that you don't have to sort of like jettison or separate yourself from the grounding of family. Like you said, starting with your why, like what really matters to you, what are you hoping to achieve? You can end up having a beautiful, unpredictable, career that you still chose. You still actively made the decisions. Like you said, you could have gone to become a neurosurgeon or internal medicine or some of the other specialties you interviewed for, but you chose family practice. It was still intentional. And yet you've had this, such a varied way of engaging and practicing in different parts of the world. And that sounds rewarding. If you could, in the last, just few moments of our conversation, share perhaps, what do you feel, if you were going to define, the core lessons that you feel you've learned about what leadership is, what it requires of you? Maybe the biggest why of leadership.
Yeah. So I'm going to say what the biggest why for leadership for me is, rather than what I think it is for everyone, because I think everyone's why for leadership will be slightly different. And if you're listening to this, please don't ever say it's money, because that's the wrong reasons to be a leader. For me, it's universal healthcare for all, no matter what. And if that means I lose my job as a physician, but it means more people can get help, that's not a bad thing. Because anything less than that would be just selfish. And so for me, the reason why I'm a leader, the reason why I want to do it, it's the impact. And that impact is helping to drive that piece within me is universal healthcare for everyone, no matter what. And it bothers me so much when I have a patient who's like, I can't have that medication because I can't afford it. Or, something that I realized a long time ago, or maybe about 10 years ago, I wish I knew it a long time ago, was, growing up in Scarborough, we had OHIP, Ontario Health Insurance Plan, which is our public healthcare system. And it was always called universal healthcare. And so we traveled to India. Somebody was begging for money to go to see a doctor. And I was like, I'm 11. I don't know anything. Or it could have been when I was 7. And my mom gave him money. And I was like, why would you do such a thing? And back then, money was such an important thing for me, which is like, I can't even get $2 to go get gumballs. Why are you giving this individual money to go to the hospital? Obviously, there's universal health care. He can just go to the hospital. And my mom taught me right there's no such thing as universal health care. And that's bothered me so much. That how can somebody across the world not get the same care? So universal health care for everyone, no matter what.
Wow. And like you said, it's knowing that why and just kind of hearing the story behind it and the clarity that it has given you for the choices that you've made is such a profound thing, Neil. Just thank you for speaking with just such authenticity. And it has given me so much to reflect on. So much of my journey resonates with yours. And I'm excited about what the future still holds for you, this journey into wilderness medicine. And hey, one of these days I'm going to call and say, are you an astronaut yet?
Please do. It'll keep me on my toes in terms of making sure I continue to apply every time they put out the applications. I think it's every 11 years they call for astronauts.
Okay. Well, I will. And I believe we will have a part 2 of this conversation because there's more I want to be able to get some insight from you on. That I will just tease the listeners that, in the future, schedules permitting, we will have a part 2. And some of the things I want to touch on is the future of AI in medicine, because I feel like that's an area that you could offer a useful framework for how to converse about AI. It feels like it's very polarizing, very difficult to talk about AI. There's either one extreme where it's anti-AI, or there's the other extreme of like, let's just let AI kind of run its course with very little restraint. And I feel like there's a happy medium in there, but we'll have to, I think, reserve that for a future conversation. But thank you for the time, the honesty. It's been a really rewarding and refreshing conversation.
Thank you so much, Joel, for giving me a chance to share and teach, and going back to that piece of impact. So I appreciate being here. Thank you. And thanks for the great questions.
You're very welcome.